I went and bought clay from the craft store, referencing my joint that I'm doing, which is a knee joint, synovial joint, in my anatomy books that I have. And I also borrowed some displays or some other references, models from my local chiropractor. So I'm going to make a model out of this clay, which will dry, and then I can paint it and add elastic bands and stuff for ligaments. Yeah. So let's get started. Okay, so I've made my bones, they've all hardened and stuff. So now I'm putting on the cartilage. Cartilage, this is the tibia, and this is the femur. So they're going to fit in like so. So I'm just finishing the cartilage. And then after I'm done the cartilage, I can put on the ligaments and the tendons and the synovial membrane and everything like that. Once those are done, I have to do some labeling and make sure that everything's in place, and then I can do my presentation. So we'll just okay, so the bones are hardened, I've done my cartilage, I've done some landmarking. Now I'm working on my tendons. I'm using elastics, numbered elastics, so I know which tendon's which, and crazy glue. Hopefully they'll stand up to the movement of the joint. It's not the prettiest joint, but it'll work, hopefully. Some of my gaps on my bones are a little bit off, so the tendons are going to be attached generally where they're supposed to be, but some of them are going to be a little bit off compared to their landmarks. I've tried to landmark as much as possible here and here, and I've got a process there, so we'll see what we can do. So here's nothing. Okay, so for my synovial joints, I actually did the largest joint in the body, which is the knee joint, the joint between the femur and tibia. This joint is called the synovial hinge joint, which allows flexion and extension, as well as minimal medial and lateral rotation. The primary structures of this joint either stabilize the joint or help with movement, aid with movement in the joint, or do both. My main structures are actually numbered because I didn't have room for labels. So I'll go over them and tell you which is which. The first main structures that I am going to point out, actually first I'm going to point out that the green elastics here are just pointing out that there's a bursa underneath either that muscle or that tendon. The bursa are little sacs of fluid. They help with protecting cartilage as well as helping with friction. So the first things I'm going to point out are the ligaments. The ligaments help hold the two bones together. This yellow clay here is the cartilage that helps the bones glide along through the joint. And the ligaments are around the cartilage. So here, the first ligament is right here. So in between there, this is our posterior view. So this ligament here is called the posterior cruciate ligament, right in the middle here, and it helps hold part of the posterior part of the joint together. The second. Okay, so my second main ligament is right beside our first ligament. The second ligament is called the posterior, I can always get this messed up, menticofemoral ligament. So it's right here and it runs along the inside of this joint all the way up towards the fibula. So that will also help with the posterior aid of extension. Our third ligament is our tibial collateral ligament. So it's going to be this one on this side. From posterior view, it's on your left side. From interior view, it's on your right. It helps with keeping those with extension and flexion. Our fourth ligament is on the other side. It's the fibular collateral ligament. So it does the exact same thing as the tibial collateral, except it's connecting to the fibula. Okay, and our fifth ligament is our anterior cruciate. So on the anterior view, right here, helps with flexion. It helps with flexion, and it's very good for the supports. Our sixth main ligament is our transverse ligament of the knee, which goes directly across underneath the cartilage and over top our fifth ligament, which was our anterior cruciate ligament. It helps keep everything in place as well as the cartilage in the bone. Okay, so those are our ligaments. We also have 7 main tendons on here. Blue are the tendons, and anything with a green on it means there's a bursa underneath the tendon. So our first tendon is our adductor magnus tendon, which is right here. Right here, sorry, I got my bone upside down. Right here, and our adductor magnus tendon would attach to our adductor, and our adductor would attach all the way up at the pelvis. It is going to be on the medial side of the leg, if you were to look at a leg in anatomical position. Our second tendon is our bicep femoris tendon, which is on, I got this bone upside down, do I? Oh, there it is, sorry. Which is right here, and this tendon will attach to our bicep femoris. Our bicep femoris is a very important muscle in the whole leg, very strong muscle. Our third tendon, is our I always mess this up, popliteus tendon, which is right here. It attaches to our popliteus muscle, which goes around and down to the other side of our tibia. It helps with the bending and extension of the knee. Our fourth tendon right here is also has a bursa underneath it, and it's called our semimembranous tendon, and it attaches to our semimembranous muscle. Our fifth tendon, which is right here, is called our iliotibial tract tendon. Otherwise, the muscle that attaches to it is otherwise referred to as the IT band. It is also a very important muscle in our leg. If your IT band is too tight, it can lead to a lot of knee injuries. And our sixth, second last tendon is right here on the medial side of the knee joint. It's the gracilis tendon, and it also attaches to the gracilis muscle. You can sense a pattern here. Most tendons are named after the muscles they attach to. And our last but not least is our sartorius tendon, which attaches the sartorius muscle, and they are pretty much right beside each other. Okay. There are also 7 main muscles shown on this model. The first muscle is the popliteus, which is right here. Okay, so this muscle laterally rotates, aids in the lateral rotation of the femur or the medial rotation of the tibia. So, for example, like so. Okay. Our second muscle is our semimembranous muscle, which is right here. Okay, so our semimembranous muscle flexes and medially rotates the calf at the knee, as well as extending, adducting, and medially rotating at the hip. Okay, so this would go all the way up to the hip and attach to the hip. Our third muscle is our gastrocnemius muscle. There's actually 2 of them, one on each side of the femur portion of the joint. As you can see, there are, blanking on terminology. There are bursa underneath the muscle. These muscles bend the knee when flexed and attach to the Achilles tendon all the way down at the foot. And then our next muscle is our plantaris, which is right here, the small muscle beside the gastrocnemius. It'll go all the way down to your foot. It flexes the foot and the knee. Our second last muscle is our gracilis, which is right here. Okay. This one adducts the thigh at the hip, so it'll go up and attach to the hip. It flexes the leg at the knee, and it also medially rotates the leg when the knee is flexed. So if you flex your knee, your leg will medially rotate, like so. Your last muscle is your sartorius, which is beside your gracilis, right here. It's a 2-jointed muscle. It moves the hip and the knee, abduction and lateral rotation of the hip, and the flexion and medial rotation of the knee. Okay, so the flexion and the medial rotation of the knee, like so. Okay, flexion and medial rotation. For knee joints, there are many different injuries that can happen. There's 55% of sports injuries happen to a knee. Due to the amount of use and impact it is forced to withstand. That's a pretty reasonable number. Some of the most common injuries for acute injuries are the ACL and the MCL sprains. So you're going to have your anterior cruciate ligament, which is right here. Okay. And your MCL, which I don't think I have on here. You can sprain those by abruptly stopping, changing direction, landing wrong after you jump, stuff like that. The MCL, when the knee joint is struck laterally, so if you were to strike it from this side, it would probably flex a little bit like this. And, okay, there's my MCL right here. That's my MCL right there. It's on the opposite side. And then you would probably sprain that side more likely than the ACL, which was struck. Overuse injuries also happen quite frequently. Inflammation of the bursa, which are underneath the tendons and the muscles, and inflammation of the patellar tendon, which I don't have on here because I didn't do the patella joint. I just did the femur and the tibia joints. The patella would be on the anterior side, right here, right like that, and it would have some tendons and some, I'm blanking, and some cartilage and some ligaments between it and the other joints. That usually comes with swelling, stiffness, tenderness, warmth, redness, inability to straighten, and locking your joint. So it can become very difficult to walk. That's everything I have on my joint today. There are many other injuries that can happen, but those are some of the most common injuries. So, thanks. Oh, yeah, by the way, these are my resources. So I have the Atlas of Human Anatomy by Frank H. Netter, Clinically Oriented Anatomy by Keith L. Moore, and a wall chart of human anatomy, 3D full body images by Thomas McCracken and Martin Griffiths. This is a really